diarrhea. Inside the bacterial causes of the secretory diarrhea, the first one we have Vibrio cholerae, which causes cholera. Is it clear? When you have a patient that has Vibrio cholerae, which causes cholera, it can be a cause of secretory diarrhea. That's the first microorganism. Second microorganism, you have Escherichia coli. Is it clear? So there are four major types of Escherichia coli. Is it clear? You have Escherichia coli entero-aggregative. You have Escherichia coli entero-aggregative. Is it clear? You have Escherichia coli enterotoxicogenic. You have the Escherichia coli enterohemolytic. And we have the Escherichia coli enteroadhesive, so enteroadhesive or penetrating. Is it clear? So this is the order of the gravidity of Escherichia coli. Aggregative and the toxicogenic are the least severe, while the most severe is hemolytic and adhesive or penetrating, because they are going to infect the deeper layers of the gastrointestinal tract, that is the intramuscular layer. Is it clear? And we have also at the level of the subserosa. Is it clear? So we have enteroaggregative and enterotoxicogenic are mostly going to affect at the level of the mucosa. Is it clear? And that is why enteroaggregative and enterotoxicogenic are the one that result to secretory diarrhea. Is it clear? They prevent, because you need to know what the mucosa is the one that is involved with the reabsorption of sodium ion and different ions with different nutrients. Is it clear? So since they affect the mucosa, it's going to result to secretory diarrhea. Now this other one, since they affect now the mural part and the subserosa, it is much more going to have result to a inflammatory diarrhea. Is it clear? Now after that, so we have the next one which can cause secretory. So we have Vibrio cholerae, we have Escherichia coli. Is it clear? So those are the ones that can result to secretory diarrhea. Now we have also Staphylococcus aureus. Is it clear? So Staphylococcus aureus, is it clear, which can be associated. So those are the different microorganisms which can be associated with Staphylococcus aureus. Those are the different microorganisms that can be associated with a secretory diarrhea. Now the next microorganism associated with secretory diarrhea are the protozoans, and the particular protozoa associated with secretory diarrhea is Giardia lamblia. Is it clear? Is Giardia lamblia. Is it clear? And Giardia lamblia is also going to result to secretions. When you have secretory diarrhea, the clinical presentation of the diarrhea is much more like a diarrhea of rice water stools. Is it clear? Rice water stools. Generally, patients that have rice water stools are secretory diarrhea. So the presentation is that it's just like the water of rice. It is foaming. Is it clear? And it is plentiful. Is it clear? When you have diarrhea with rice water stool, you think of secretory diarrhea. It can be water, noro, all those microorganisms. Is it clear? Particularly, that is a hallmark of Vibrio cholerae or cholera, provided that you are in the context of cholera. Is it clear? And to investigate for secretory diarrhea, you ask for the osmolarity. The osmolarity is going to be less than 300 moles, and then you ask for the ions of the feces. You are going to see that the ion level of the feces is going to be elevated, and you have also a reduced ion level of blood. Is it clear? Particularly in secretory diarrhea. And secretory diarrhea, the major complication of secretory diarrhea is a malabsorption syndrome. Is it clear? If this diarrhea is going to be prolonged, particularly in the case of Giardia lamblia, where the diarrhea can be chronic, you can have malabsorption syndrome. Is it clear? Other protozoa can result to secretory diarrhea. We have other like isospora, we have cyclospora, we have those microorganisms are most associated with HIV. Is it clear? Immunosuppression. So those are, and then the next complication is the one that is associated with enterotoxicogenic and enterohemolytic. This complication is going to be called hemolytic uremic syndrome. Is it clear? And hemolytic uremic syndrome, in this case, you have the release. It is both associated with Shigella, when you have cases of Shigella, and you have cases of Escherichia coli enterohemolytic or enterotoxicogenic, because they produce a certain toxin which is just resembling like the Shiga toxin. Is it clear? And that Shiga toxin results to a hemolysis or intravascular hemolysis. Is it clear? Since it results to intravascular hemolysis, you need to know that what hemoglobin, it can and is capable of causing what? Acute tubular necrosis. Is it clear? Hemoglobin is capable of causing acute tubular necrosis. So you are going to have a toxicogenic acute tubular necrosis. And when you have a toxicogenic acute tubular necrosis, is going to present now with a uremia. Why? Because the patient also has a renal failure with the mechanism which is being tubular from a toxicogenic acute tubular necrosis. And the urine of this patient is going to be brownish color, because in cases of acute tubular necrosis, you have brown cast which are going to be released. Is it clear? So those are the different elements that you can have. Other method where which you can have the uremia is there a glomerulonephritis, which is occurring as a result still of the hemolysis. So those are the different elements that you have to visualize as a complication. Now, the next element that you need to visualize now, after visualizing secretory diarrhea, you need to now go to inflammatory diarrhea. Is it clear? So inflammatory diarrhea, generally the presentation of these patients with inflammatory diarrhea is that they present with fever, they present with abdominal pain, and the diarrhea may have blood. Is it clear? So the test that you ask in order to assess that there is blood, if you don't have a macroscopic blood, you may have microscopic blood, which can be seen with a fecal-occult blood test. Is it clear? So fecal-occult blood test can just help you to support that there is an inflammatory diarrhea, and then to confirm, you do a stool analysis. Is it clear? You can also support by asking for the procalcitonin. Is it clear? Procalcitonin also help you to know that there is inflammation at the level of the feces. And then the next one, to confirm now that there is inflammation, you do a stool analysis. And in stool analysis, you're going to visualize white blood cells inside the stools, and then you're going to visualize red blood cells inside the stools. And lastly, you are also going to visualize those microorganisms. Is it clear? Microorganisms. Now, for inflammatory diarrhea, the different causes of inflammatory diarrhea. You can start with viral. Is it clear? The major viral cause of inflammatory diarrhea is enterovirus. Enterovirus can cause inflammatory diarrhea. We have cytomegalovirus. But cytomegalovirus usually occur in the case of immunocompromised. Is it clear? Or we have also arbovirus. But other etiologies which are less common but can result to inflammatory diarrhea. We have rotavirus. And we have the case of norovirus. Is it clear? Now, after the viruses, we have the bacteria which can result to inflammatory diarrhea. The bacteria is a mnemonic sepsis. You just use a mnemonic sepsis. S is for Salmonella typhi. Is it clear? Salmonella typhi. The next S is for Salmonella typhi. The next S is for Shigella. Is it clear? Salmonella typhi, Shigella. E is for Escherichia coli. And those Escherichia coli involve